My conference is about physical culture, health, and social developments in Mexico. I am Dr. Siria Margarita Salazar. I appreciate the opportunity given to me this year by the Physical Education Foundation of India to speak in the framework of the National Conference of Physical Education, Sport and Health. For the University of Colima, it's a privilege to construct bridges to strengthen ties of cooperation and advance together to improve the conditions of our community's inhabitants. I also want to thank Piyush Jain, Secretary of the Foundation, for the support and attention, who is a visionary for the cause of physical education in his country.
Today, I want to share with you an overview of the evolution of what we call physical culture in Mexico, the implications for physical and mental health of the citizens, civilized contributions, and of control in some communities, and the agenda of recreation, which allows citizens to coexist with their family, friends, and society in general. Although, structurally, the government system is much more complex and not enough to organize a country with 111 million inhabitants, INEGI 2010. Living and coexisting in a distal geographic, political, polarized, and with ecosystem diversity, therefore, government efforts have been moderately successful. In the late 60s, the term physical culture in Mexico was settled in the formal speech. At the time, was referring to the tangible and immanent wells and behaviors that people had regarding fitness and sporting practice. The government organization that institutionalized the concept 25 years ago was the Comisión Nacional del Deporte, CONADE, or National Sports Commission, now called Comisión Cultura Física y Deporte, or Commission of Physical Culture and Sports. These days, the concept has not changed radically. From this year, and with the contribution of the National Law of Physical Culture and Sports, physical culture is understood as part of the culture that represents the collection of experiences and achievements in the creation and application of principles, fundamentals, conditions, methodologies aimed at the exercise of human beings, expressions, and human achievements in physical activity aimed at leisure, education, competition, physical fitness, and health. CONADE 2014. So CONADE is responsible for promoting national policies on sports in the country and is decentralized office of the Ministry of Education. Until today, CONADE's successes have led to a massive sports promotion to children and youth at high levels competition performance. The country has found their national sports athletes and their presence in the world in this mechanism initiated in 1990. This program called National Olympiad brings together more than 50,000 talents per year of 32 provinces in 46 sports. This sports promotion has also been extended to society or not competitive groups that meet to coexist by the traditional sporting, neighborhood sporting leagues, or informal practices. However, this format becomes unique to citizens with physical abilities and skills for the practice of exclusive sports and rigid schedules. What prevents a large percentage of Mexicans included this offer, which is very limited. Regarding physical education, similarly, the Minister of Education provides the guidelines for the operation of National Program of Physical Education, which has an office that organizes and distributes the necessary goods for teaching to 12 grades of basic education, from preschool to high school. It also has rules for teachers' training in this area. Physical education in Mexico has gone from an English, French, and Spanish model to a current one that congregates models, implemented in 2011, resulting from the most innovative and distinct from all previous occurred. The appearance of physical education in our country is recorded the Lancastrian School in 1822, being initially a free and recreational practice, until 1923 became official in the records of the nation's connotations of gymnastic, hygienic education, bodily education, and fencing, with the creation of operational and specialized structures for its treatment. In the field of educational models since Mexico recorded are A. The military approach began in 1940, characterized by an order and control and walking motions and bodily discipline. B. In 1968, sports approach appears on the boom of the Olympic Games held that year in the country, based on sporting training. Sessions were divided in 3 phases: warm-up, central work, and relaxation. C. Physiomotor approach promoted in 1974, it sought the mind and body integration through conscientious movement practice. D. Organic functional approach undertaken in 1988, the main trend was the development of physical fitness and abilities. E. Motor dynamic integration approach initiated in 1993 and mainly focused on the development of physical abilities, conditional, and with an emphasis on sporting development. F. Finally, the current approach dates from 2008 until now. It follows the constructivist line with a competence approach called global motivity. In this, the student assumes a role as the protagonist of the session, at the same time exploring and experiencing motivity with peers, assuming shared codes of conduct and communication. It means to understand that the motivity plays a key role in the exploration and knowledge of its corporeality, dexterities, and motor skills, as it shares and constructs with peers an own style of relationship and motor development, which is conceived a critical, reflective, analytical, and proactive student, at school and in different areas of performance in which it manages. In other words, after 12 years, Mexicans who completed their basic education must be accomplished. The corporality as a global expression of the person, enable expression and skill development and motor dexterities and mobility control for the development of creative performance. A critical level in the schoolyard, the physical education class is not enough to break even the well-established military and sporting paradigms. This coincides with the training received by teachers and what the Dutch scientist Bart Kroom notes as a vicious circle of physical education. In Mexico, the institutions empowered to offer physical culture programs are by tradition the higher education schools, and each time with greater primacies the universities. These latest ones may be subclassified as federal public universities, state public universities, federal public universities with solidarity support, technological institutes, and technological universities. Historical teachers training schools correspond to the state through the higher education schools, or also called schools for teachers. History tells us that it began recruiting for the first generations of teachers, those who ended up until 6th year of basic education. Further schools growth was insufficient with demanded professionals that allowed athletes and coaches so they could practice as physical educators. In the early 40s, the Autonomous University of Chihuahua offers the first university degree in physical education and sports. Later, about 100 universities offering public and private degrees programs in the fields of physical culture. However, this has diversified the knowledge and put the professional in a dilemma. It's taught to educate the body or to physically prepare the body or rehabilitate. It's teacher, coach, rehabilitation, recreational entertainer, organizer, or nutritionist, etc. So great is the distance that has been found in the concept of physical culture to take all the container and steer, trying to make it homogeneous mass of knowledge. Physical culture, not possessing its own epimistic body, it appropriates the knowledge of their science and disciplinary fields to restrain and develop. Until today, there are 3 major areas of knowledge: regulation and professional standards, which determine the formation of resource in our country in this field: education, physical education, social development, sports and recreation, and health promotion, pre-inscription of the exercise. If it's true, the present nationwide educational programs that are professionals in physical culture and sports in Mexico assume major importance in the sense that physical education is no longer a curricular subject and crosses borders to confer significant links to the field or health. healthy habits, and well-being and quality of life. Thereupon, offering educational programs with this trend represents to Mexico an area of opportunity to contribute from academics, researchers, and students, addressing to the several problems faced by Mexican society on health, obesity, among others. In such sense that the physical culture and sport is relevant vehicle to awareness towards school, social, and personal responsibility. Professional trends in physical culture and sports and motion. Different models or paradigms have been incorporated to address the most relevant trends, characterized by their understanding the teaching-learning process, to the teacher and the conditioning of the success or failure of this process. This situation has been consolidated at trial or judgment on the teacher's training, using each case, their own training programs with objectives, different approaches and methodologies that have to do with the training model implemented or developed by any time. Spanish professor Manuel Bisuete notes that physical education in the last 4 decades has passed from simple practice that was done without regard to the reason for it as a justified practice, finding the meaning of it, then the installation of the content, and finally the implementation of special didactics for an emerging science, with which the human body went from being passive object to being a conscious and protagonist subject. Not just the changes brought by this new bodily culture, but by its own vital needs that the Western society model demand as a sign of quality and life expectancy. These conceptual evolutions have been moved to the university work, which has led to a permanent change of roles in the profiles of the graduates of training schools, from those instructors of physical activity to teacher subjects, and thereafter has not been given continuity to the new teachers of physical education. Social development and health of Mexicans. The deep crisis in which physical education and diversification posts of health care provided by the state keeps the country in disagreement and confusion, but the long list of health problems that arise due to the lack of specificity of the political exercising are also added. I externally briefly the major issues arising from the macro structure and impact on social development and by the hands on health. First one is linked to the harmful use of alcohol, the same that is associated with other major mental health problems in Mexico. One of the public health problems, and also a global comparison, alcohol consumption has been normalized in society or even ignored as common in the adolescent population. Number two, the scientific literature reports evidence of behaviors that are adopted after the consumption and of alcohol abuse, association with drugs, cigarettes, antisocial behaviors, and domestic violence. Number three, the Mopradev INEGI survey in Physical Activity 2014 describes the Mexicans' habits. It reports that the Mexican population of 18 years and over in urban areas is physically inactive in 56.2%, 42% male and 58% are female. The time they spend per week on physical activity is 3 hours 56 minutes, preferably in the morning. The survey also reveals that a higher academic qualification is a higher percentage of physical active population. The certain or physical inactivity population refers to the lack of time. 4. Obesity and overweight are the main public health problem in Mexico because our country is in the first place worldwide in overweight and obese children and second in adults. Mexico spends 7% of the health budget addressed to obesity, just behind the United States that invests 9%. Mortality is 12 times higher in young people aged from 25 to 35, and this 25% of work disability are obesity-related conditions that cause between 24% and 34% increase in family incomes, and 3 of 4 hospitals beds are occupied by patients with obesity-related diseases. Poor diets, sedentary lifestyles, lack of access to nutritious food is major determinant factors of overweight and obesity. The major challenge for Mexico. Once you know the ways that Mexico has passed, I have to say, has not been easy. Too many opportunities arise in a country that is slowly but surely approaching to a science as a key element of public policy. After this brief overview, we consider that Mexicans have 3 challenges that should work on. The first one is to concentrate the political efforts in creating a single policy for the stabilization of health, derived from sedentary and pacific lifestyles and unbalanced energetically. Second one, that teacher education programs that are offered at national level should be positioned in a specific field in order to mark out shifts in the training process. Obviously, the reality shows peculiar situations in which there are curriculums that not assume unique positions and yes, hybrid, a situation that is discussed in more detail in later categories. And the last one, development of an appraisable and flexible recreational exercise programs with a highly charged, allowing the inclusion of all segments of the population, should be imposed to all the interest and the need for citizens on the homogenization of physical practice.
I appreciate the time, patience, and above all the cordiality to strengthen ties of the friendship and knowledge. Thank you.